Welcome to the Igniting Impact podcast brought to you by Public Knowledge. I'm Stacey Moss, the host of the podcast and the president of our management consulting firm. Our firm's vision is to be a catalyst for change, leaving each person, project, client, colleague, and community better than when we began. The Igniting Impact podcast is an opportunity to share what our clients and partners do daily that impacts the world. We want to highlight this essential work and the work that they do for their customers and stakeholders that is changing lives despite the many challenges that they face. On today's episode, we have two guests with us, Jasmine Hayes from ICF and Will Hornsby from Public Knowledge. They are here today to discuss how their firms and organizations support child welfare agencies to improve their practice and outcomes for children and families. Welcome to each of you. I'm so glad to have you both on the podcast today. Let's go ahead and start by getting to know you each a little bit more. If you could each tell us a bit about yourself and your background, what you do for work right now, and how did you get there? And Will, if you don't mind starting, that'd be great.
So I'm Will Hornsby. I'm the Senior Vice President for Delivery for Public Knowledge. I've been doing management consulting work for over 13 years now. Prior to that, I worked for the state of Alabama with the child welfare system there. I was there for about 9 years and worked at the county level and the state level. And we were involved in a pretty large child welfare transformation effort within the system in Alabama at that time. So I was the benefit of being early in my career and really benefiting from this kind of large systemic change effort. From there, I went to work for the Children's Bureau with the Department of Health and Human Services, doing the Child and Family Service Reviews. I did that for about 9 years, and I was a part of the team that kicked those off in the first round of the reviews. And we made the decision, my wife and I, when we had our daughter, that we wanted to get closer to family. So made the decision to move back to Alabama. And that's when I transitioned from my government work to, I went to work for Center for the Support of Families. And then it was from there that we integrated and became a part of Public Knowledge.
Great. Thanks, Will. Jasmine?
Hi, good morning. Well, it's great to be here. So a little bit about me and my background. Currently, I serve as the project director of the Capacity Building Center for States. This is a technical assistance project that is funded by the Children's Bureau within the U.S. Department of Health and Human Services. And I'm also the portfolio lead for our tailored technical assistance portfolio within child welfare and education here at ICF. All right, so how did I get here? I love telling the story. So I actually born and raised in Canada. I graduated from the University of Toronto with a Master of Social Work. That's where I started my career in child welfare in Toronto, working at the Catholic Children's Aid Society, which is the equivalent to the local child welfare agencies here in the U.S. I came to the U.S. in 2002, and at the time, I worked with the City of Alexandria's Department of Social Services, and I was part of a unit that was a bit of a pilot. We had multiple cases, so rather than having just child protection or just family assessment, I actually had a number of different kinds of cases. So I had child protection, in-home, foster care. I really enjoyed that. It gave me an opportunity to connect with families in a different way, right? So we actually carried the cases from that initial contact with families all the way through achieving permanency or case closure. That experience for me, I think that really early experience began to shift some things in how I thought about practice, how I thought about social work, how I thought about child welfare. And I was really interested in, the policies, the practices that were impacting how we could interact and the ways in which we did support or frankly not support families and young people. And I really want to know how are decisions being made at the state level? And so I had an opportunity to go to a state level position in the District of Columbia. I was the administrator over planning, policy, and program support. So it's a lot of the non-case carrying functions. It included preparing and being lead for the Child and Family Service reviews that Will just talked about, our 4E plans. I also, though, while I was there, had an opportunity to be part of starting and implementing a primary prevention grant-funded project. And that also then started to spark some things for me. Okay, I've got the state level experience, but I still want to know, how are some of these federal laws that are impacting how we design state policy that then translates to local practice? How's that happening? And how do I get to be part of those conversations and potentially influence, or at least inform some of the thinking there? So from the state level, I then had an opportunity to go to federal service, and I joined the U.S. Interagency Council on Homelessness, where I was the deputy director. And in that role, I saw firsthand what cross-system collaboration can really look like. We worked with 19 federal agencies. My role specifically was overseeing all of our work related to family and youth homelessness. And so I had an opportunity to bring that child welfare perspective, particularly with families and young people, and then had the opportunity to come to ICF, which is where I am now. And in many ways, it felt a bit of a full circle moment in my child welfare career. I'm working with a number of the same folks that I worked while I was in my federal role, but now bringing that experience and sort of that lens of federal, national, state, local, and helping to think about how we deliver services through this technical assistance project has been really a wonderful opportunity for me. So that's me in a nutshell.
That's great. I cannot imagine trying to work with 19 different agencies. So I'm still stuck on that number. That seems like a monumental task. Okay, well, let's get to know you both on a more personal level. If you'll tell us kind of who you are outside of work and what values you live your life by. And we could just go in the same order if that's okay, Will.
Outside of work, I love being a dad. I love our family. Our daughter will be a senior in high school next year. We've got a young person that's very important to our family who's a senior in college. And my wife and I are, she's engaged in developing a nonprofit that's focused on caregiver support for cancer patients. And it's just a time right now of just trying to be present with the family, being present with ending the junior year of high school, moving into senior year of high school, being present with that kind of getting towards the end of college and looking at making the transition from there. And my wife is halfway through getting her doctorate. So I find myself really keyed into kind of education right now and trying to support and help those who are so important to me as they're at kind of these pivotal points in their lives. So that's a little bit about me right now.
Jasmine?
Yeah, I love this question. So outside of work, I'm a mom of 2 teens. I have a high school sophomore and a high school senior. So right now, my life is a lot of sports, a lot of senior recognition moments, trying to soak in these last few months before my daughter graduates high school and heads to college. She'll be studying nursing at Clemson. Go Tigers. And the values that I hold most dear really are centered around family. I would say well-being, health and well-being, adaptability. I've really been thinking about that, particularly over the last year or so with my kiddos. Integrity and a growth mindset. And I think those are values that have been integral to me on a personal level, and then have also been really important when I have transitioned to different roles because I want to ensure there's alignment there with both the personal and professional values that are important to me.
That's great. Thanks so much for sharing that with us, both of you. It's nice to get a little glimpse into both work, but also personal as well. Okay, well, let's turn now to what we're here to talk about today, which is just ICF and PK's kind of experience and expertise in supporting child welfare agencies to improve their practice while kind of considering services that are grounded in race equity, engaging people with lived experience and expertise, and implementing evidence-based practices. So at a kind of global level, my first question is just kind of what problems do ICF and PK try to solve? Like, what problems are you there helping your clients with? And Jasmine, if you want to go first, that'd be great.
Sure. So I'll start with ICF's purpose, right? Our purpose is to build a more prosperous and resilient world for all. So I think about this as mission-driven work. So the work that we engage in, the actions that we take, that's what contributes to that mission. And we use our ingenuity, our creativity, we bring diverse and interdisciplinary perspectives to solve those problems, those toughest challenges that our clients have. That's a very high level. When I zoom into where I sit, my work within the child welfare and education area, the challenge that we're trying to solve is how do we ensure children, youth, and families are safe and thriving, right? I think that's it. That's what we're trying to do. So some of our projects have a very particular charge or an audience. A lot of times that's driven by federal priorities, by funding, but really what it is we're trying to address are the challenges that have impacted families and young people at a community level, at an organizational or systemic level. So I think that's the big picture.
That's great. Thank you. And Will, what about public knowledge?
Similar to what Jasmine was describing in relation to ICF, I think particularly with public knowledge and child welfare, we are really focused on trying to help solve problems, and primarily our clients are governmental agencies, and oftentimes there's something that's really causing pressure, concern, that is driving these child welfare professionals to seek assistance, to seek support, to seek help in trying to better understand the challenge and the problem, and then to think about what do we need to put in place to address this and to move forward. And, the one thing with being 30 years in a career that's been really focused on child welfare, there's so many issues that range from specific issues with the children and families who are being served, with issues that an agency may be challenged with structurally with their workforce, dealing with requirements from the federal level, from the state level. And then also connected with this is just when you think about the role of financing, when you think about the role of changing laws and regulations and trying to help navigate and problem solve in that sphere is, I find it to be very satisfying work. And we have a number of projects where we're working on various problems, within that area.
Yeah, satisfying and challenging, I think is a good way of describing it. Well, it made me think, so I'm curious what both of you would say if you look at the child welfare industry around us today, right? Because I think all three of us have worked in this area for a long time, but if we look today and we look to the future, what do you each think is the biggest challenge and the biggest problem that needs to be solved, whether or not we're working on it or our clients are working on it? But what do you think is the biggest, hairiest problem that we need to be focused on solving in the future?
That's such a good question. So there's a couple of things that come to mind. I mean, first and foremost, I would say one of the biggest challenges is and Will touched on this, right? There's a workforce crisis. that's impacting child welfare. And it's connected to a lot of things in my mind. We certainly, over the years, child welfare, like so many social services systems or programs, have always been challenged with workforce retention, recruitment and retention. But I think COVID illuminated that challenge. It then intensified it even more. And you couple that sort of that workforce crisis with regards to the ability or the challenge to retain staff. You couple that with, I think, the challenge that new social workers have as they really consider the role they are playing and as part of a system that has contributed to and made worse, frankly, disparities among different populations, including populations of color, and communities that have been historically underserved through child welfare and other human services agencies. So underserved in the ways, when it comes to resources, connections, and then overrepresented, right? Where the challenges that face families, individuals, that in some settings, communities can connect and identify resources and supports, and it's part of that collaborative support and understanding that all families face crisis and need support. But then there are communities that when they are in crisis, the reaction is then there has to be a system involvement, right? And then that further deepens the crisis. And so for social workers who may be earlier in their career, there does become this question of what's my role in that. I mentioned what it was like for me early in my career, starting to really think about what my role was. So I think that's one big part of it. And then there continues to be this shift, I'd call it a shift towards, prevention, right? Which is super broad. It's very broad. This idea of if we can move further upstream, if we can provide safety nets, community supports that are there, that are accessible, that are responsive, that are culturally responsive to the needs of families and young people, could we then start to see a difference in how child welfare interacts with families, the reasons that perhaps families come into contact with systems? Could there be a change there? So I would say kind of the biggest crisis is workforce, but workforce is connected to so many parts of what we call the child welfare system.
Well, and connected to what you said, like the very basis on which it was created, right?
Right.
Look backwards. I think that's exactly right. Well, thanks, Jasmine. That's great. Will, any thoughts on the biggest problem we're facing?
What I'll add is associated with what Jasmine is describing. When I step back and think about it, the state child welfare agencies and how there are times when there are forces and pressures that people have relied on very insular approaches, reactive decision-making, risk-adverse approaches that, when we're looking at trying to think through and grapple with the issues that Jasmine was describing, being open enough to really engage with people who have experienced the system and who have a knowledge and perspective, and really thinking about how can there be design work done, how can there be decisions being made that are moving away from such an insular reactive approach. I think that's a massive challenge. And I think that there's places where progress is being made, but when I think about nationally the child welfare field, that's one of the things that where my mind goes in relation to the question, Stacey.
It sounds like reimagining, right? Again, what this system is, but doing so with the voices of the children and families and communities that are actually being served rather than driven by the professionals.
Absolutely.
Yeah.
And how difficult and challenging that can be for a number of reasons. And one of the base threshold needs is the understanding that broader perspectives, other voices, other experiences, and other knowledge is a good thing and is needed.
Yeah. Yeah. And I think to build on that, I believe that if we kind of start with those who are most impacted by what it is we're trying to change or where we see some of the challenges, it actually has that ripple effect, right? Of then it becomes better for all.
It does. Yeah. Yeah. And I think then that's part of the prevention that I like the most.
Right.
This move is because then we're really talking about all of us. We're not othering people in the system, right? Whether their backgrounds or not, but it's really about all of us and our communities and our families and our children. And I think that's what gets me excited every day. So that really turns me, I think that where I've seen that done well, right? Kind of this reimagining, redesigning, and I think we've only seen it in small pockets so far, right? But when we've seen that and it's driven by those with lived expertise, I do think that's where we see a lot of impact these days. And that kind of takes us to my next topic. So one of our core values at PK is impact. And we've really developed this whole podcast around it because really we want to make sure that we're focused on it all the time because it allows us to drive progress. It's essential to our work. And for us, we define impact as approaching every project, right, or every engagement with our energy focused on identifying the right goals, outcomes, and strategies, which are often not the ones that people are talking about, and that we each have a personal responsibility to make a positive impact on our projects and our world. And Jasmine, when you shared ICF's mission earlier, I got a smile on my face because it seems very aligned, which is probably why we align very well. But looking a little bit deeper at kind of the child welfare efforts and projects, I'm wondering what impact you hope to have, not just personally, but as project teams and as organizations, and on whom?
Yeah, I'm happy to take that. So you did reference our purpose, right? So with my ICF hat, I would say that it goes right back to our purpose, building a more prosperous and resilient world for all. That's the impact we're trying to have. And the whom, it really is, at the end of the day, it's children, young people, and families, right? That's the work that we're focused on. That's why we're here. It's to work alongside our partners. Our partners are at the federal level, they're at the state level, they're at the community level. We want to ensure we're learning from, we're aligning with them. And it's about both a short-term impact and long-term sustainable change. That's really what, for me, that's part of what gets me up every day and excited to come to work.
That's great. Will, what about you?
I feel lucky that when I think about my current work and when I think about my career, Jasmine talked about kind of mission oriented earlier in our discussion, trying to be a part of helping to make children and families safer, trying to strengthen families, trying to look at our children growing up in a setting that is going to nurture them and put them in a place to be able to be well and to be able to, progress. So I feel lucky that that's how I've been able to spend my time with my work every day. And then getting to work with other people who that is kind of their passion, what they want to do. With PK, we are really trying to move from just thinking about it and it being theoretical, but really trying to push ourselves and push our clients to think about what is the impact that we're wanting to have with this effort, with this project. And that's looking beyond meeting discrete deadlines or delivering specific deliverables, and of really thinking about what are we trying to achieve here? What are we trying to impact? What are we trying to change? What is this going to make different as we're moving forward? And that's very exciting. And well, let's just go to our theme here. It's satisfying and challenging, I think is the phrase.
Yeah. And I think what you talked about is important, right? Because what we want to be doing is testing, right? So if we have a great theoretical idea, how do we test it and make sure it works? Which takes us to kind of the whole theme. So this year's theme for the podcast is generating and using evidence to drive impact or change, right? And so how are we testing and then checking, right? Whether that's through CQI, whether that's through just a quick evaluation or a full blown out evaluation, but how are we using data and evidence to actually make decisions, drive impact, and drive change? So let's turn to that right now, and let's talk a bit about what evidence you're generating and using to kind of show success or failure, right? Because sometimes that is more important than what works. Are either of you using evidence and data that already existed in projects, or are you generating your own for these efforts, or is it a combo of both? And if you have some examples, that would be great.
So I guess I would think about this across all of our work, right? Yeah. Data is integral to how we approach service delivery. So if we're working with a state or we're working with a jurisdiction, we'll start with what they have. And then we go from there. We help them to analyze their data to understand what it does, and as important, what it doesn't tell them, where there may be gaps. And then what we bring to the table is our deep knowledge and our expertise related to evidence-based practices, as well as years of research and evaluation. So I think to answer your question, I'd say it's a combination of both, right? We always want to start with what does the client already have? And a lot of times they have a lot of information. It's helping them to understand it, right? Mm-hmm. To think through the kinds of questions they should be asking themselves about the data, the kind of questions their data raises for them. And we want to tailor our responses. We do have some great examples of how our Center for States project has partnered with jurisdictions to build capacity and improve outcomes. I'll say every project looks different, but they're all part of our capacity building approach to service delivery, which is an ongoing evidence-informed process. So from the beginning, right, when we are going to engage whatever that project is, we want to start with the data that already exists, and then we look at how we can supplement it.
You make a good point, because I think we've transitioned right over the last 15 or so years to our clients not having a lot of data or any data to now they have so much data. And so it's often figuring out how to sift through it, how to bring what's most important to the top, right? And how to get them to focus on how to use it and understand it, rather than where we used to be, which was how do you find the data and create data. So it is a big shift.
I would also add, and I think especially as we are having more conversations about equity and what it means to advance racial equity, to also challenge when we're looking at data, right? And so I mentioned earlier to ask that question of what's missing?
Yeah.
Right? Because the data that you have, you can use that, but it could also be overlooking a key population, or you could be missing a question in there, right? Why is there a data point that's not being collected? And what would it tell you if it was, right? So I think having that critical eye when we are looking at the data and what the evidence is telling us should also be to think, okay, well, what is missing here?
That's great. Will, what about you?
Feel lucky because last week I was able to be at the table with a client of ours that we've worked with for several years, and with our team who is involved with them. And it was this great experience because we went back and talked about the theory of change that was developed at the beginning of our work with them. And then just everyone being able to see and understand how that early work has driven what we've done together for multiple years now. And we're looking at some new work with another part of an organization. And it was clear of, all right, we have to take the same approach. We have to think about gathering the information, getting the right people involved and engaged, and developing a theory of change to guide, where we're going to head with that work, which is, forces us to think about what are the short-term outcomes that we're looking for, what are the long-term outcomes, how are we going to measure this. We were able to talk about specific data points around some pretty robust measures around the impact of different training and coaching efforts that have been put in place. Also, some real pointed measures around financial goals and looking at how tying funding decisions to implementing interventions and how that's impacting the work. So, Stacy, this is good timing because that is fresh in my mind, and it reinforces for me the importance at the beginning of really thinking about what do we want to achieve, and what is that going to look like, and how are we going to know that we got there. So, and that what Jasmine was describing in regards to their work, this requires attention, skill, focus, and commitment on an agency's part and on a firm's part to try to really guide the work and really understand what progress is being made or what is not being made and what we need to do.
Yeah, well, what that really brings up for me, it just reinforces your measure of success has to be tied to the problem or challenge you're trying to
Right.
right? Because I think we can fall into that trap of we come up with a list of indicators, but if you then really look at them, what is that actually going to tell you at the end of this project? Does it actually connect to the problem you defined at the beginning? So thinking about what success would look like, the how will we know things have changed question, that is really important to do at the beginning, and that can be hard.
Yeah, so my question to both of you is how do you go about doing that well, right? Deciding on what evidence will actually be your measure for success on any given project or thing that you're measuring. What would be your advice for making sure that you do that well? I heard, make sure we do it at the beginning, make sure it's answering the ultimate question or problem, but anything else that you guys would add to that?
Well, I would say part of that conversation at the beginning is making sure, thinking about who's in the room as you're defining success, right? So we talked a little bit about the importance of lived experience and expertise. So asking individuals or communities who are or have been or will be most impacted by the change that is being implemented, and applying a continuous quality improvement approach throughout the work, right? So this isn't just about establishing measures and having a baseline, and then at the end of the project, let's see how things have changed. It's really important over time, and knowing that sometimes those measures may have to change, and that's okay.
Or the interventions, that's why you're looking at it,
right? Yeah, that's exactly right.
Yeah, and I think we talked a couple of podcasts ago, Will, about how hard it is sometimes, right, to let go of your great idea or that plan, right, when you realize that the data is showing you it's not working, but how important it is as well. So
yeah, absolutely. And Jasmine, when I think about this, so I'm thinking about ICF and I'm thinking about PK. There's also, Stacy, so then just really having the right people with the skills, the background, the knowledge that can understand the quantitative data, if it's, aggregate data from an information system, qualitative data, if it's information that's coming from stakeholder interviews, if there's information coming from some type of case review process or other CQI efforts. But, having in Jasmine, in my mind, I'm thinking of people within your organization and people within our organization who are really skilled and gifted at being able to work with a client around understanding what information is available and then how to communicate and use that with the key players, the people that need to be involved. And that is a real skill, talent. And, there's people who are better at doing that and trying to get them plugged in and able to work in a meaningful way is so important.
Well, and what it also, I would build on that, Will, by saying what I think is really impactful when we are supporting various projects is knowing you bring in different people based on where you are in the implementation of a project, right? So at the beginning, you are going to need folks who really can understand the data, who can help break it down, who can work with the client to understand it, to message to various audiences. And then things may shift to an actual practice implementation or some other effort. And so being able to pull people in and really tailor the response to a jurisdiction, I think that's something that's really important. And again, it helps to model the expectations for jurisdictions or states we're working with, because you can't rely on just one individual to carry the change, right? You have to draw from the capacity, or you support the strengthening and building of capacity within an organization so that they can continue and sustain the change efforts over time.
Yeah, so I think this actually takes me to my next question, which is you guys are starting to hit on kind of what are some lessons learned or advice, right, that you can share with our listeners who are kind of embarking on any type of change work or, systems change work that they could use, but also that you're going to be bringing forward into your future projects. What else can we share about lessons learned for doing this work and measuring and using data and evidence?
Well, I would say, and this is just really summing up what we've talked about, be clear about the problem or the challenge you're trying to solve, right? So start with the data. Be clear about what success means. Define your measures. Think about what would be different if you solved your challenge that you've identified, right? And how will you know? How will you know more short-term, immediate? And then what would be different long-term? So that gets to the outcome change, impact. Bring a mindset of continuous quality improvement. And, the last thing I'll say here is to keep equity, racial equity, the voices and expertise of those most impacted by the problem you're trying to solve at the core of the work.
Thanks, Jasmine.
Jasmine, that's great. So, Stacey, going back earlier in our discussion, I also think lessons learned is there's a level of courage, commitment, leadership, desire to ask the hard questions and open yourself up to really trying to understand what do we need to know to better understand the problem, and then to look at having some positive impact. And so I completely agree with Jasmine's summary, but I also think that this is an area where it does need to be coupled with the importance of leadership, the importance of the willingness to try to understand really what is happening with the children and the families being served. And then what does that mean in terms of the questions that we're going to openly ask and that we're going to try to really understand, and then what are we going to measure, and how does that move forward? Jasmine has referenced it a couple of times in relation to just really thinking about what information are we gathering, what other questions should be asked, and what else should we be putting in place to understand people's experiences with the system and how to move forward and to be successful in the interventions or the efforts that a system is trying to put in place to make positive movement forward. And I think that that's something that we have to be willing to take on, just like, saying that we need to understand up front what the problem is and what the measures are, but we also need to understand, all right, are we ready to take this on?
Yeah. Will, that the leadership component is critical, right? That leadership buy-in, leadership support. While leadership may not be in the day-to-day project work of the change that is being sought, leadership is absolutely critical to ensuring the work can continue, right? So I think that's another important support resource that we bring to our respective projects, and that is about helping teams with their messaging, with soliciting that buy-in, right? Understanding, and frankly, helping to understand from a leadership perspective, because they're also under a lot of pressure. They're being asked and expected to respond to various challenges. So trying to find kind of that space where there can be shared agreement about the goal and the outcomes that are being sought is really important as well.
Thank you. Well, all right, we're getting towards the end, and I have a little fun activity before we to close us out. But before we wrap up, is there anything else that you'd like to share with the listeners about any of the topics that we talked about today, or any other final lessons learned?
I would say, from what we've talked about, it can seem overwhelming to think about large system change, and in many ways, that's true, especially when we think about moving from where things have been, are entrenched, and we're really trying to move to more equitable service delivery and practice. And we're seeing that change. I think we're seeing that consistently across the board in various pockets and at various stages. So yes, that can be really overwhelming, but perhaps, one lesson learned or some insight is focus on, maybe start with one opportunity for change, right? Begin to build capacity in that area, test what works, what doesn't, adjust as you go, seek feedback and learning from those who are most impacted by and are part of that change, making sure they're integral to driving those changes. To me, that's how we begin to impact the larger system.
Great. Thank you, Jasmine. Will, anything else before we close out?
With the discussion and with us starting out, talking about how Jasmine ended up doing this work and me thinking about how I ended up doing this work. And I referenced kind of early in my career being involved in a real system transformation effort for a state child welfare agency. And one of the tenets of that is, a basic belief that people can change. And I believe that. And I also think institutions can change. And I think it is possible. And so Jasmine, I agree with this is possible. How do we move forward? What is the best way to, is it focusing on an area, thinking about, how to make that happen? But I'm a firm believer that change is possible. And what we've been discussing here is the way to do it, is understanding what the problem is and then trying to really understand what is happening as a change intervention is being put in place.
All right. Love it. Well, to close out every podcast, we have a little bit of fun by just asking each of you to share some of your wisdom and advice around one of our core values. So we built the podcast around one of our 3 core values, impact. But to close out, we're hoping that you'll share your thoughts on the other 2 core values, which are inclusion and teamwork. No pressure. This is just whatever comes to mind first, and hopefully just a little, bite of advice that someone can take with them. And if it's okay, Will, I'll have you start and then Jasmine go next, just since you already know what they are. Okay. Well, the first question is just, what is your best advice for achieving high levels of inclusion in the workplace?
And I referenced this earlier, about courage. I think that we have to really step back and think about, and Jasmine was talking about taking like an interdisciplinary approach. I think that when someone is really open to and believes that we is better than I, and that something better happens when different perspectives are being voiced, when different experiences, different knowledge is being brought to the table, then inclusion is a foundation to that being able to happen. And then depending on your organization, depending on where you are, that may require you taking different approaches to recruiting and hiring, to thinking about pulling a team together to approach a problem, to think about who's going to be in a leadership role. I guess, my thought is advice is having the courage and thinking about how important inclusion is and how can you impact that in the role that you're in. And then, that kind of goes hand in hand with teamwork from the standpoint of Jasmine with public knowledge. We have a very strong belief in the power of teams, in teaming, how we can best have an impact with our clients. And it's by who we're putting together as a team to be able to work together. It's kind of foundational to the way that we look at approaching our work with clients, and that we look at moving forward and working on a project. So I guess my final thought here is thinking about best advice is having the courage and the commitment to believe in this, and then how in your role can you push it forward?
Thank you. Jasmine, what about you? What's your best advice for achieving high levels of inclusion in the workplace?
Well, for me, it starts with your organization's stated values, right? Do they reflect inclusion? Do they reflect diversity, equity, and inclusion? Is there a stated commitment to inclusion? It starts there, right? Will talked about this. Is it in your hiring and recruitment practices? Is it reflected in who's in various positions across the organization? Do you see diverse perspectives? Is there space for that? That could be employee resource groups. I am actually the co-chair, one of the co-chairs of ICF's Women Employee Community Network, which is one of our many employee affinity groups across the organization. So the opportunities to support and create space for different ideas, different perspectives. So there's leadership coaching, there are training opportunities, growth opportunities. It's about how we are investing internally in our staff. To me, that then creates opportunities to model for our clients what it means to be inclusive, which is very connected to teamwork, right? If you're going to achieve high levels of teamwork, it needs to be a diverse and inclusive workplace. If we can come to work as our whole selves, if we can feel connected to one another, to the work that we're doing, that's what contributes to a sense of community, of teamwork. And my experience has been that teamwork starts with leadership, really holding those values central to how work and services are delivered across the organization. So model the expectations for collaboration and authentic engagement that you want to see. That's what creates a place of work where people are excited to come, to share, to challenge, to be challenged, but all in a way of thinking about ongoing learning and growth.
Yeah, Jasmine, you think about the connection between inclusion and teamwork the same way I do. So I love that. I don't think that you can get to true teamwork without it. So I would definitely agree. All right, well, that takes us to our last question, Will, which is just what's your best advice for achieving high levels of teamwork in the workplace?
One of the things with public knowledge that I've appreciated is that, internally, we've done some training for all of us that's, leadership focused, but it is also focused on teams and teaming and thinking about how to structure a team and how to work with a team to make decisions and to move things forward, and for the team to function in a way to where everyone's heard, to where you can move to a decision that's built on concurring opinions and full information. And so, Stacy, when I think about, some of my prior work experiences, one of the things that we've done with Public Knowledge is we've taken the time internally to focus on this, to do some specific training and skill development. And then, as Jasmine was saying, that's how we're trying to approach our work. That is resulting in modeling and demonstrating how to try to move forward with strong teams and having a group of people who can, do something greater than if it was a sole individual.
Yeah. Jasmine, what about you?
I think just as I said, these are all really closely connected, right? That if we have high levels of inclusion in the workplace, I would argue you're going to see high levels of teamwork. And that's at an organizational level, that's at an individual project level. I would say what's also really important is to ask folks what it means to them to feel like they're included, to feel like they are part of a team. Because I may have an idea and think, wow, we're working really well as a team. But if I haven't actually talked to my teammates and asked them, I could be missing something, right? So taking those opportunities, I think that's really important for leadership to connect with one another. But that's just across the board. And I think also appreciating that sometimes teams are going to have challenges. In fact, I would be surprised if they didn't. But our ability to work through those challenges or differences, that's how ultimately you still maintain a high level of teamwork across the board. So going into new teams, new places of work, new organizations, really connecting your core values with the organizational values, I think that's how you drive towards or achieve high levels of both inclusion and teamwork in the workplace.
It's such a good point. I think often people go looking for a new job or take a new job without asking, in my mind, one of the most important questions, which is, what are your values, right? And does the organization live by them? Because without that alignment, you could be doing the best work in the world, but it's not going to be very fulfilling. So it's such an important point to make sure that there is alignment between some of your personal values and some of the organization's. Thanks for that. All right. Well, I can't thank you both enough for your time today. It's been just a privilege to be here with you, to connect, to learn, to grow, to breathe, and to share. Until next time.